So John, we talked a bit about the patients who present with those what we call functional NETs or symptoms. What are some of the hormones that cause all the symptoms in the patients you see with neuroendocrine cancer?
Right. So the most common syndrome by far, of course, is the carcinoid syndrome, and there are a bunch of vasoactive factors that are involved, but serotonin is the most prominent hormone. We think the serotonin is directly responsible for diarrhea. It may be partially responsible for the flushing that patients experience, and it's probably the main factor behind carcinoid heart disease, which involves damage to primarily to the right-sided heart valves, tricuspid and pulmonary. But there are other vasoactive substances such as prostaglandins, bradykinins, tachykinins, etc. Then there are the rarer hormonal syndromes, primarily associated with pancreatic NETs. So insulinomas, of course, produce insulin or proinsulin, leading to episodes of hypoglycemia. Gastrinomas produce gastrin, leading to Zollinger-Ellison syndrome, a high acid state. Most physicians expect heartburn and ulcers as a consequence of that, but it's important to recognize that diarrhea is also an important symptom associated with gastrinomas. Of course, nowadays with proton pump inhibitors, the diagnosis of ZE syndrome is often delayed for many years and can be masked because PPIs are so effective. Then there are the ultra-rare syndromes, the VIPomas producing VIP, which can result in severe watery diarrhea and electrolyte abnormalities, glucogenomas that can cause weight loss, cachexia, an unusual rash called necrolytic migratory erythema, hyperglycemia. So those are really quite unusual. And then there's others. Some pancreatic NETs as well as lung NETs can cause ectopic Cushing syndrome. Others can produce PTH or PTHrP, leading to hypercalcemia. So the number of potential hormones is actually quite large.
So it makes it clear that we have to take a really good history and listen to our patients from what they're telling us. Yeah.
What are your thoughts on quality of life in patients with functional NETs versus non-functioning?
Well, I think, patients who have functional NETs and those who are symptomatic from the different hormones, but primarily serotonin that you talked about, those are really, it can really impact a person's life. Diarrhea can be debilitating. It can prevent normal mobility. It can prevent a person from working, from enjoying quality of life. I had a patient recently who was really impacted by the fact that he couldn't go watch his son's hockey games because he was always afraid that he wouldn't be able to get to the bathroom in time.
It's definitely a Canadian issue.
That definitely affected his quality of life. And so I think we have to take this very seriously and be aggressive with the treatment so that we can ensure that our patients can get on with their normal life as best as possible given the constraints of the disease.
Right.